Welcome to the weekly checkup on ReachMD for the week of September 21st, 2015. This week's news segment proves that there may be positive benefits associated with extended sun exposure. A recent study shows a link between Alzheimer's disease and vitamin D deficiency. Nearly half the participants in the study had low levels of vitamin D in their blood. This is cause for alarm, but don't jump into the tanning bed too fast. While this study appears to show correlation, study author Joshua Miller warns that increased intake of the vitamin may not prevent mental decline. For more updates on this story, head to ReachMD.com. Continuing ReachMD's monthly focus on geriatrics and aging, learn why emergency departments are less than ideal for elderly patients and how EDs can acclimate for seniors in the segment, Tailoring the Emergency Room for Older Patients. And now for a quick look at some of our latest featured content. Head over to Everyday Family Medicine with Dr. Jennifer Caudill to learn about the emerging subspecialty of OBGYN hospitalists and how these clinicians are working to create a safety net in delivery of women's health care. After studying up on the latest in this new arena of medicine, learn how to decipher the truth behind risk assessment for cardiovascular disease on Lipid Laminations. Turns out physicians may need to pay closer attention to causation and less to risk factors. To continue this week, Dr. Matt Bernholtz explores a unique use for peanut butter in clinical practice on a new edition of Curious Headlines.
Peanut butter. It's crunchy, it's creamy, it's delicious. If you don't like it, you might not be American. And if you can't smell it, you might have Alzheimer's? Turns out that might actually be true to some extent. Research published in the Journal of Neurological Sciences is touting a peanut butter smell test, which proposes to help detect early Alzheimer's disease. It's based on a study finding that patients with early-stage Alzheimer's exhibit a significant impairment in their sense of smell, specifically from the left side. This unilateral loss of smell may be attributed to the pattern of brain shrinkage seen in Alzheimer's, often beginning, of course, at the left temporal lobe. Ergo, peanut butter smell test, which came about when researchers compared sense of smell in Alzheimer's patients versus healthy adults. They found that Alzheimer's patients needed to be 10 centimeters closer than healthy counterparts just to identify the smell of peanut butter from the left side. So what does this mean for practice standards? Well, in a large hospital with access to PET scanners and spinal taps, probably not too much. But elsewhere, maybe something to consider trying out. And if you're asking yourself, why peanut butter and not something like, say, anchovies or cave-aged cheese of some kind? Well, let me just remind you that this is America. We'll use peanut butter, thank you very much. Smells like memory. To your mental health, America. I'm Dr. Matt Bernholtz.
For more of Dr. Bernholtz and everyone at ReachMD, check out all of our featured content at ReachMD.com or by listening on iHeartRadio or TuneIn. Thank you for joining us this week. I'm Sherry Neely for ReachMD, inviting you to be part of the knowledge.